everyone, my name is Taylor and I'm with Ethereal Skin and we're back with our Method Monday. Today's topic is radiofrequency microneedling. We're going to go into all things you need to know when considering a device to best match with your results and your goals that you're trying to achieve. So there's a lot of different radiofrequency devices. I hear this a lot. Why should we pick SYLFIRM? Why did our practice pick SYLFIRM? And let's kind of chop up what all of the other devices are doing, why ours is different, and what are the benefits that you can receive from all of these devices. So let's jump into it. How many RFs are there? A lot. Virtue RF, Secret, Vivace, Lutronic Genius, Morpheus 8, and the list goes. There are so many incredible RFs. What is the difference though? Well, there's 3 indicators on how you can find and pick a good RF. One is asking, is the needle insulated or non-insulated? And we're gonna get into why all of these are so important. What is the depth and what does it start off as? Let's talk about pain. Is there a comfort menu? Is there Pronox? Do you even need Pronox? And let's get into why all of these are really big indicators of why you should pick a certain device based off of what your goal is. So let's chat. First one is non-insulated or insulated. The difference between a non-insulated needle and an insulated needle when you're talking about an energy-based device is a non-insulated needle is meaning the entire needle is coagulated, meaning it's delivering heat throughout the entire needle, which is then distributing a more even heat pattern along the skin's layers and whatever depth they're in. When an insulated needle is presented within our facial structure or anywhere throughout our body, it tends to hurt a lot more. The reason is because as soon as the needle goes in, the tip of it is very hot. That's where the heat is focused at. So as soon as it penetrates the skin, it's pinchy or plain, or we maybe need more Pronox, or maybe we need an actual lidocaine injectable. This is because that is how the device was made. As technology continues to improve and the innovation continues to expand, companies and doctors are starting to expand their knowledge as well on what is the best way to deliver this treatment in safe perimeters, but to not be painful. SYLFIRM is the least painful device out of every single RF I just named. And I can tell you that from patients sitting in my chair, myself, I have gotten every single one of those done to myself and I've worked with them. The main key point is why. There's 2 reasons. One, because our device has non-insulated needles, meaning, like I said, that energy is delivered throughout the entire tip. And 2, we have actually 2 different energy routes, which is a dual wave, which is the only RF machine in the aesthetic realm, and it's the only FDA cleared, where we're actually able to measure your energy and deliver you the goal that you want based off of 2 settings, CW, which is continuous wave, and pulse wave. There is no other RF microneedling device in aesthetics that has pulse wave except SYLFIRM. So now, why does it not become painful if you're dealing with 2 different energy realms? Well, we're controlling everything from depths. We can start at 0.0 millimeters, okay? That is the depth going into the skin, which is, I will get into why depth is important. Some of these microneedling devices start at 1 millimeter, not 0.001, 1. You should never do 1 on your forehead, okay? It's a whole other topic, but that is why these devices are painful. So when an indicator that you're looking for a good device, depth, insulated or non-insulated, and let's talk about pain. Getting back to pulse wave and continuous wave. Pulse wave is the first and only device able to be carried, and it's treating concerns like melasma, rosacea, diffuse redness. It's targeting pigment, hyperpigment, and you can see in some of these issues, right? When you hypopigment and is not from the sun, it's actually able to be treated, but in a superficial depth, which is why SYLFIRM allows us such a various of a range to customize your treatment. So it's a not one-size-fits-all approach. It's really important. So not only are you coming in to help fix the laxity, maybe the jowling, and to tighten up the skin, but you're getting optimal results with pigment, redness. We can target cheiriangiomas. And the reason is we're working in a 300 micron depth, meaning we're targeting all 3 skin layers at once. Some of the other devices have non-insulated tips. The Secret RF, they have non-insulated and semi-insulated, which is great for them. But the thing about Secret is they don't have PW. So maybe Secret wouldn't be the best option for you if you're trying to target diffuse redness, but also laxity and jowling, because then you get a 2-in-1 with SYLFIRM. Another great comparison is Lutronic. Lutronic's tips are insulated, meaning it's non-insulated, meaning that tip is only carrying energy at the very tip of it. So it can seem a little bit more painful. If you compare SYLFIRM and Lutronic on a scale, they're gonna see Lutronic's a little bit more painful, no matter what the comfort menu is or how much numbing they're putting on that patient topically or even injecting. Well, why would somebody go with Lutronic and not SYLFIRM? Well, there's a few indicators. Maybe they're only focused on laxity. Maybe they're only focused on jowling. Maybe they're working on trying to prevent anti-aging. Maybe they're working to prevent aging from occurring. That's a great option. But say they are having diffuse redness, they're having some rosacea, some melasma, uneven skin tone. Lutronic is not able to help with that because they do not have pulse wave. The benefits of microneedling are to repair laxity, jowling, skin tightening, the skin integrity, pore size. It can help with tone. It might be able to help with texture, but I see a lot of textural issues because people are dry, because people are not hydrating properly. Another thing with our device here is we have the only device, again, that's FDA cleared to go over eyelids, meaning we have safe and effective protocols to help with that. So blepharoplasties are out of the window over here. If you continue doing treatments, I like to set the standard as 6 for upper eyelids and lower. You might not even need a bleph. You might not even need to go under local anesthesia. So RF microneedling is truly powerful. Now, why are people getting worried and concerned about fat wasting? Understand that localized fat and why is it going away? Well, there's 2 reasons, and this is why I always tell you guys, ask about insulated and non-insulated in the depth. If there is a microneedling device that starts on 1.0 millimeters and they can rack their energy up to a very high level, they are going into a plane of your face that is burning that localized fat. That is now where the jowling can occur. That is sometimes where you can see the face start to droop and sag in areas, because not only did the provider just burn the fat out of the face, it's on a completely wrong setting and it should be superficial. So the technology with SYLFIRM is we're working superficially. We're targeting things in a 300 micron depth. So we're hitting all 3 skin layers in one. It's incredible. Do your research on devices. All of the devices I named are incredible, but for specific areas. I love Morpheus for body. I love Morpheus for body tightening. I would recommend somebody to go get a Morpheus for body tightening because of the way the stamping method is and how the heat is delivered. Really rack their heat up. But now, would I consider Morpheus for somebody that has diffuse redness and some pigmentation and uneven skin? I would not. I would recommend them to get a SYLFIRM. You have to understand pain level as well. I have a lot of women that come in that have horror stories of RF microneedling experiences, and I want to let you guys know it's because of all of the factors and indicators I just shared. So I hope you have a better understanding and can now pick a device that's suiting for you and your needs based off of your concern and where you want to be with goals. I hope your providers are being honest with you and it can really break down their technology to tell you why they carry it and why it might be the best. So chat next Monday about a new topic. Bye.